Good afternoon, good morning, and welcome to the first in a series of 3 webinars on air pollution and health in Southeast Europe. My name is Eliane Van Vliet, and I'm a staff scientist at HEI. As some of you know, the Health Effects Institute, or HEI, works on air pollution and health in the US and globally. We focus on answering questions related to health effects of air pollution with a view to inform policy. And this has resulted in over 300 studies focused on a variety of questions related to exposure, related to health effects, and also health impacts of air pollution in countries around the world. We also spend time synthesizing and reviewing the evidence to understand the current knowledge and information. And in fact, we have a major review of literature of traffic-related air pollution and its health effects coming out early next year. Within the Institute, we also have a global health program that's focused on the synthesis of available evidence, access to data on air quality and health for countries around the world, as well as technical support and capacity building. Earlier this year, we launched a project in Southeastern Europe with support from the Clean Air Fund with the goal of reviewing and summarizing the available evidence on air quality trends, sources of air pollution, health effects, and potential health burden in the region. And we're also focusing on Bulgaria and Serbia as 2 specific examples. And within this project, we're looking to build local connections and networks among a variety of groups, including scientists, physicians, civil society groups. And this webinar series is our latest effort to continue some of the conversations on air pollution and health related topics, following from our virtual workshop in June of this year. So before we delve into today's webinar, just a few technical notes. All attendees will be muted and in view only mode, and there will be Q&A period after each of our sessions. Please submit your questions via the Q&A function at any time during the webinar. You can also upvote these questions in the Q&A function. If you experience any logistical difficulties at all, you can contact us using your chat box. And all webinar slides and video will be available in the coming weeks on our YouTube channel. Please check back on our website for details. And if you plan to post about the webinars on social media, please use this hashtag shown here. And thank you for completing the post workshop that you'll be emailed tomorrow. So we have a very interesting webinar for you today with an esteemed group of speakers who will discuss the global and regional evidence on health effects of air pollution in Southeast Europe. And to lead our way through today's webinar, it's my honor to introduce today's session chairs. Dr. Mira Jovanovski Dasic, Director of the Southeast Europe Health Network Secretariat with seat in Skopje, North Macedonia. She has worked for more than 2 decades as a medical doctor and specialist pediatrician in the public and private health sectors. She's worked in the government of Montenegro with WHO and has advised numerous international public health organizations. And Vlatka Matkovic, who is HEAL's Senior Health and Energy Officer. Ms. Matkovic leads the work on the implementation of health and environment rules for coal plants in the EU and in the Balkans. She coordinates Unmask My City campaign in Balkans and is working to raise awareness about health impacts of air pollution from different energy sources. Vlatka is particularly interested in building health allies and engaging medical professionals in a wider health, climate, and energy debate. So today's webinar will start with opening remarks on the global evidence on health effects of air pollution. Then we'll turn to perspectives from Serbia, as well as regional perspective from the Balkans United for Clean Air campaign. And finally, we will hear about evidence on health effects of air pollution from researchers in Kosovo and North Macedonia. I will now give the floor to Dr. Mira Dasic to lead us into the webinar and introduce our first speaker. Mira, please, the floor is yours.
Thank you. Good afternoon, dear participants, speakers, and colleagues. It is my honor to co-chair the webinar, Global and Regional Evidence on Health Effects of Air Pollution, Case of Southeastern Europe, with Ms. Vlatka Matkovic from HEAL. Let me introduce our first speaker. Dr. Zorana Andersen. Dr. Andersen is a professor in environmental epidemiology at the Department of Public Health, University of Copenhagen, and chair of the European Respiratory Society Environment and Health Committee. Her main research areas include health effects of long-term exposures to air pollution. Professor Andersen is passionate about advocacy on clean air and translation of knowledge from research to policy. The title of her presentation is Health Effects of Air Pollution. Dr. Andersen, the screen is yours.
Thank you very much, Mira, for a kind introduction, and thank you for inviting me to speak at this webinar. I'm very pleased to be here and speak about a very important topic about health and air pollution, especially in the region here. So today I'll just give you a brief overview of main knowledge about health effects of air pollution, and I will start just briefly talking about what we know biologically, how air pollution adversely affects our health, and then give you an overview of what do we know now based on both mechanistic understanding and large epidemiological evidence we know on what are the main effects of air pollution, and end up with some conclusion about a global impact on air pollution, our health, and conclusions and recommendations for research here in the region. So the main mechanisms on the effect of air pollution on our health are rather well understood now after decades of research. We know that the main impact of air pollution happens through inflammation and oxidative stress in a number of organs in our body. And of course, main understanding on our health effects of air pollution came on the research of how air we inhale impacts our lung. And that's the area we know most about it, have perhaps researched longest about. We also know now, beyond inflammation and oxidative stress, that outdoor air pollution, particularly matter and diesel, are all declared carcinogenic by the International Agency on Research on Cancer. And this, of course, has been shown in epidemiological studies, and impact on air pollution on lung cancer, which is now causally established. Beyond lung, now in the later, more recent years, we have also large understanding how particles and gases, after they inhaled in our lungs and reach the alveoli, transfer to blood and can reach pretty much all the organs and all the systems in our body. And as you can see in this schematic, through blood can reach through our blood vessels and heart and affect adversely cardiovascular system, which Professor Dasic will talk more about. Fat tissue, low-grade inflammation, which can lead to metabolic diseases and development diabetes, through very exciting area of research to how air pollution impacts our brain, both through impact through cardiovascular vessels, but also direct exposure to brain, possible through olfactory membrane exposure through after inhalation via nose. So this is just a brief snapshot of how much we already know and how much has been researched on impact on air pollution in all our organs in the body. There's also a very nice review that just has been published about health effects of environment and also air pollution at a very fine cellular level. And there is these 7 pillars or hallmarks of environmental insults. And I invite you to go into this paper if you want to go a little bit more at the cellular level of how air pollution impacts our cells, and by this impacts pretty much all our organs. This is also very nice reading and shows that we know already quite a lot on how air pollution affects all of these organs. So just briefly to summarize, if we look summary of all the epidemiological evidence that we have in last decades, this schematic in bold letters shows the diseases that we have, or health outcomes or disease outcomes that we have very decent to very strong evidence on that air pollution is dangerous for. So we know now that air pollution definitely shortens our life and increases risk of premature all-cause mortality from any cause. We know that air pollution affects our respiratory system, as I have mentioned, and by this we mean that air pollution shortens, increases risk of premature mortality, dying premature from respiratory diseases, and impacts also risk of developing respiratory diseases, both chronic respiratory diseases such as asthma, chronic obstructive pulmonary disease, and but also infectious diseases such as pneumonia. And right now we have emerging evidence on the link between COVID-19 and air pollution, which is very interesting, and especially this time. We also, as I mentioned, know a lot now about cardiovascular disease and impact of air pollution on a number of health outcomes related to cardiovascular diseases. Air pollution increases both mortality and morbidity due to a number of serious cardiovascular outcomes, including myocardial infarction and stroke that have been studied most. But recently, we also have emerging evidence that air pollution also increases risk of disturbances of heart rhythm, such as atrial fibrillation, as well as heart failure, which is a very serious condition. We also, I mentioned cancer and carcinogenicity of air pollution. We know solid evidence, we have solid evidence of lung cancer, but we also have fast emerging evidence now that air pollution may also causally be affecting other cancers than lung. And by this, as we know that cancer is one of the major causes of death next to cardiovascular disease, this will have a major impact in our understanding of the impact of air pollution. We have increasing evidence now, liver cancer, brain cancer, breast cancer, and so on. And of course, biological plausibility is there with air pollution being carcinogenic. We still have too few studies to conclude on causal relationship, but they are fastly coming out. We have now solid evidence for establishing association between air pollution and type 2 diabetes, both mortality and morbidity, as mentioned. And these two areas are very interesting areas of research on increasing risk of air pollution related to dementia and Alzheimer's, neurodegenerative diseases, as well as Parkinson's disease and possible some others. And some of the weakest evidence, but also fast emerging, is on the possible link of air pollution with our mental health. And hereby we have few studies now on depression and suicide. Elderly are considered most susceptible, but I also want to point out that, of course, another very important and susceptible group to air pollution is children. And here we know that air pollution adversely affects the development of lungs in children and increases risk of asthma, as well as respiratory infections in children. And possibly also links between diabetes type 1, children cancers are being researched, as well as we know that there's a negative impact on neurodevelopment, cognitive development, on learning and ability to perform in school, possibly also on a serious condition such as autism and ADHD. Pregnant women are another very susceptible group, and we know now that exposure during pregnancy adversely impacts the newborn in terms of lower birth weight and possibly also some other serious outcomes that can lead to poor health later in the life. As well as for mother, air pollution increases risk of preeclampsia and gestational hypertension in mother. If you look a little bit more globally, we know now that that air pollution is that everybody's pretty much exposed to certain levels of air pollution, and with the new WHO guideline that came out just last Wednesday, the WHO, based on health effect studies, has set a new recommendation for PM 2.5 to be 5 micrograms per cubic meter, with solid knowledge that everything above 5 is dangerous for our health. This means the yellow box I have above was based on the old recommendation of 10 micrograms per cubic meter. Based on that, considering that everything above 10 is dangerous, we had 92% of world population exposed to air pollution. So now with the new lower limit down to 5, we know that even more people are exposed to dangerous levels of air pollution, even in areas of the world like Northern Europe, where we consider to be fairly clean. We have new understanding that air pollution is more dangerous than we thought, even at low levels. And this is the new WHO quality guidelines that you can see also stricter levels for a number of other pollutants. And here, I only talk about PM 2.5. When this translates to number of deaths, I just want to point out that a burden is huge on the global scale. 7 million deaths now are attributed to air pollution. I also wanted to point out the important fact that burden of air pollution on health is increasing. If you look at our burden of health estimate from 2015, it was about 4.2. Now it's 7. This is due to several mechanisms. One is aging and demographic, but also that we have increasing understanding with new epidemiological and mechanistic evidence fastly coming out in comparison to 2015, where you have these 5 diseases causally linked to air pollution, COPD, ischemic heart disease, lower respiratory infection, lung cancer, stroke. Now, the newest calculation of global burden of disease includes diabetes and neonatal deaths. And that's one of the reasons for this huge increase in number of deaths globally to air pollution. And we know now that in future, with new diseases being added, with likely dementia and some others, we'll have increase in number of people affected by air pollution, even if we achieve the decreases in air pollution. This, because everybody's exposed, because air pollution affects so many diseases outcomes, and affects all of us during entire lifetime, air pollution is one of the main risk factors for disease, morbidity, and mortality. And it's ranked now number 4 after high blood pressure, tobacco use, and dietary risks. So we really are dealing with one of the main risks for disease globally. Also, another point to make, although new recommendation is set at 5 by WHO, we know that air pollution, that there is no lower threshold. This is just based on evidence we have, but air pollution is dangerous at all levels. And there is no threshold association. There is no such a thing as safe air pollution level. So just to conclude, air pollution is a major global health risk for disease, morbidity, and mortality. Health burden is found at all levels, as reinstated now in new WHO report. Even at low levels, air pollution is dangerous for our health. And burden is likely to increase with new understanding of health effects related to air pollution. Call for action is justified and is urgent. The health effects we have now are unacceptable, and current legislation and the parts of the world where we have it does not protect us adequately from dangerous effects of air pollution. Although we know so much about air pollution, I cannot state enough that we need still more research in the areas of the world where we do not know much about health effects, such as in Southeastern Europe, here in Serbia, Bulgaria, and all other countries we'll hear about from today. Nothing can replace local estimates based on local populations with local sources and mix of air pollution that we have, and those are certainly very different in Southeastern Europe than from the studies we have mainly from Western Europe and Northern Europe right now. So I look very much forward to today to hear this early showcase of studies and that we know already from this region. And I think this is just a nice start of call for more studies and more research to be done in the region to provide data to do more about air pollution in the long run. And with this, I will end my speech and give a word back to Mira.
Thank you very much, Zorana, for this inspiring presentation. And if there are questions, please send them via the chat box. In order not to lose time, our second speaker is Dr. Nebojša Dasic. Dr. Nebojša Dasic is a clinical cardiologist and a specialist of internal medicine. He's currently professor of internal medicine, medical faculty, University of Belgrade, Serbia, and assistant director for cardiovascular research, Dedinje Cardiovascular Institute, Belgrade, Serbia. He also serves as the president for Hypertension, Infarction, Stroke Prevention Association and the International Society for Vascular Health. He has previously worked at the WHO. The title of his presentation is Effects of Air Pollution on Cardiovascular Diseases in Serbia. Dr. Dasic, the floor is yours.
Thank you very much. I want to first thank the organizers for invitation, and I also want to thank Zorana for a very nice overview of the current situation of the impact of air pollution on the health in general. And I am going to talk a little bit about air pollution also in general and its effect on the health in Serbia. And of course, I will emphasize its importance to the cardiovascular disease. I just want to remind the audience that as well as the all Eastern Europe, more than half of deaths are attributed to the cardiovascular disease, so mostly myocardial infarction and stroke. But I want to point out that at the moment we have a very interesting situation. Zorana told that more than 6 million people are dying from air pollution. We know that also about 6 to 7, maybe even more, are dying from COVID-19. And as you know, at the moment, we have 3 pandemics. Actually, pandemic of air pollution mortality, pandemic of COVID-19 morbidity and mortality, and pandemic of non-communicable diseases. And these 3 curves are crossing very often, so we are in a very dangerous situation for health in general. If we look to the age standardized mortality from non-communicable disease, we have the very different situation in different parts of the world, and Eastern Europe and Balkans, of course, very much affected. What is very important to know that for a long period, the PM concentration in Serbia exceeds the EU and WHO standards. As you can see, this is more or less the situation that some average PM for 2.5 is 36 and PM10 53 microgram per cubic meters. But official data are a little bit optimistic, because if we see the death rate from the ambient, in particular air pollution, we see that from the beginning of this century, we have a steady state, and then the curve is going down. And the same curve we see for the cardiovascular disease. But this is the annual number of deaths from cardiovascular disease per 100,000 people. But still, the situation is not good, and I will show you in the next slides. In accordance with the WHO guidelines, the air quality in Serbia is considered moderately unsafe. But the last years, we see it's not the case. We have a very, very bad situation, and official data indicates that the country's annual mean concentration of PM 2.5 is 25, which of course exceeds the recommended maximum even for the newest guidelines of 10 microgram per cubic meters. And the contributors to poor air quality in Serbia include the automobile industry, food processing, and vehicle emissions. The seasonal variation exists with higher level of air pollution occurring in the winter. And of course, available data indicates that Belgrade has consistently high levels of air pollution. A few years ago, very nice, it's not the article, it's more or less the study, Health Impact of Ambient Air Pollution in Serbia, call to action was published, and it showed several things. So we have in 11 cities automatic monitoring stations for PM 2.5 and 10, of course, also for NO2 and SO2 and ozone. And we can see that in these 11 countries, this automatic stations show that this is the number of days per year with PM10 concentration over 50. We can see that for some cities in the last, I mean, not in the last, but from 2010 to 2015, for example, for Belgrade and Obrenovac, almost 1/3 of year, we have a very, very bad situation. Also, if we look at the city of Valjevo for 2.5 and PM10, we can see these up and down curves, which shows variation, not just seasonal, but also in between the same month. But annual levels of PM10 and PM 2.5, these 5 years analysis in this 11 cities shows very bad results. And you can see it really exceeds some average from Europe, especially with the cities with the heavy industries like Belgrade, Smederevo, Obrenovac, Lazarevac, with some cities relatively good like Novi Sad. And this graphic also showed that some cities are very much endangered, as I say, maybe Smederevo in the middle because it has a very huge steel factory. Anyway, let's go back to the cardiovascular disease. This is the estimates of 3 things: premature deaths, years of lost life, and disability adjusted life years. And we can see that really for ischemic heart disease is 3,111, and for stroke 1,576 definitely are attributed to the premature death according to the air pollution, which as a percent is a very, very huge. And this exposure accounts for 3,585 premature deaths per year, including almost 2,000 in Belgrade, and other health outcomes are linked to exposure to NO2 and O3, although they are not reported here. And over the next 10 years, it should be this year's live low air pollution expected to persist, especially in Belgrade. But this study was between 2010 2015, and we are witnessing extremely high level of 2.5 and PM10 in the last several years, and Belgrade is among the most endangered cities regarding air pollution, but I don't have the official data yet reported, and we are trying to find them. But we know that from the daily reports. There are only a few investigations about the cardiovascular disease and air pollution in Serbia. This is one of them done in Novi Sad, but it was concentrated more on NO2 and SO2. But it showed very clearly that cardiovascular disease admission to hospitals are really increased in the times of year when the air pollution was very high. So what we should do, I think definitely as a conclusion, we have to decrease the use of solid fuels for household heating and cooking, which is much the case in Serbia. We have to reduce emissions from industrial sites. We have to change to more sustainable mobility. We have to improve planning to increase the energy efficiency of buildings and make cities greener and more compact. We have to increase the use of low emission fuels and renewable combustion free power sources, and of course, implement the new strategies for waste reduction, separation, recycling, reuse. And if we have to improve the communication and awareness of risk. And I have to say that in the last few months, there was a very huge civil movements, almost riots in the Serbia related to the not just air pollution, but the pollution of water and other environmental insults, as Zorana stated it very clearly. So we are at the moment witnessing some kind of huge protests related. Of course, I will show that there is a clear reason WHO and World Health Organization how to address cardiovascular diseases, and of course, prevention is maybe most important. Together with surveillance and management, we have to reduce exposure to risk factors. And my last slide, I am both invasive and preventive cardiologist, but I strongly believe that the future of mankind are in the hand of prevention, and air pollution and all other environmental insults are very, very important to deal with, and only with the preventive measures we can stop that. Thank you for your attention.
Thank you, Dr. Dasic, for the comprehensive presentation. I would like now to present our third speaker on the same topic, Dr. Samir Lemesh. He's a representative for the Balkans United for Clean Air campaign and the coordinator of the Aarhus Center Zenica, Bosnia and Herzegovina. Employed at the University of Zenica as the associate professor, he volunteers in the local environmental NGO Ecoforum Zenica. Professor Lemesh has published a number of books and scientific papers and is well known as a thought-provoking speaker. The title of his presentation is Effects of Air Pollution on Cardiovascular Diseases in Serbia, Part 2. Dr. Lemesh, the floor is yours.
Thank you. I hope that you can see my presentation. Actually, there is a misunderstanding about the title of the presentation, because my presentation is about the campaign that we performed during the beginning of this year, and the campaign title was Balkans United for Clean Air. You can find more on the internet about the campaign by using this hashtag Balkans United for Clean Air. The campaign was initiated by the European Fund from the Balkans, from Belgrade, Serbia, in partnership with a number of environmental NGOs from Serbia, Albania, Bosnia and Herzegovina, Kosovo, North Macedonia, and Montenegro. We all participated, and we jointly prepared a number of presentations and some media press releases, and these were joined by more than 435 individuals and organizations from the Western Balkans and even beyond the Western Balkans. The aim of the campaign was to inform the citizens of this area about the causes and consequences of air pollution. So we used all these studies that were presented in the previous two presentations and similar sources. And of course, we also presented some possible solutions which would improve air quality. The aim of the campaign is actually awareness raising, because we still don't have enough awareness among the public about the importance of this issue. Only informed person is motivated and prepared to engage in common and solidarity struggle for clean air locally, in their street, in their neighborhood, in their village, and in their city. The campaign was open, and all materials were made available to any citizen of the Western Balkans who wanted to join a solidarity-based struggle for clean air. You see that I mentioned the word solidarity a number of times because that was the key word of the campaign. So because the polluted air knows no borders, so we decided also to have no borders among us and to solidarily help each other to fight this problem. Between January and April this year, we tackled 6 topics. First one was generally air pollution in the region. Second topic was related to COVID-19 because we managed to collect information how air pollution affected and what were the relations between COVID-19 pandemics and air pollution. Third campaign was about relations between mortality and air pollution. And the fourth one, connections between infertility and air pollution. We used the official data about how many babies do we lose due to the polluted air. The final 2 campaigns were about the big polluters in the region, and finally monitoring and informing citizens about air pollution. These topics were simultaneously promoted every 2 weeks by all local partners in all local languages, on social networks and through traditional media, giving the statements to the press media, to the TV stations, to internet portals, etc. These are the illustrations that were created for this campaign. The first one was about the numbers. We wanted to point out that, for example, 16 thermal power plants in the Western Balkans pollute more than 250 same facilities throughout the European Union. Then the second one was illustration with the COVID-19. Then we wanted to add some interesting video by using this relation to the quiz, trying to tackle people to think about air pollution. This is the illustration about the babies that we lose due to the air pollution. Then we had something about the pollution sources, mainly energy and industrial sources. And finally, what can be done and what are the information necessary to fight air pollution. So I will end with this slide showing some shocking images from my hometown, from Zenica, Bosnia and Herzegovina. You can see our everyday sources of air pollution, which are actually invisible. They are visible by our eyes, but they are invisible by the official data. And this is what I would like to point out. We need 2 very important information to be publicly available. The first information is to have air quality data in easy to understand way presented. So we have this display, as you can see, 969 micrograms per cubic meter of sulfur dioxide. This is common during the winter in our city, but people really don't understand much what these numbers mean. So I think that unique air quality index could be an asset to get more attention and to raise awareness. And the second very important information is the PRTR, or Register of Polluters, and the amounts of pollution coming out from different sources. Because I said these air pollution sources are invisible, because they always say it's not only us, you have households, you have traffic, you have waste depots. So we need to have proper data in order to quantify the air pollution sources, and then to do the actions to reduce them in order to protect the health. So thank you for the attention. I will be more than ready to discuss it in the Q&A or live. Thank you.
Thank you very much, Dr. Lemes, for the interesting and provocative presentation. And I really apologize for the title, but this is what I received. So now, since the first part has been completed, we are waiting for the questions and the answers. I see that there have been some questions in the chat box. Would you like to answer to them now in audio? I think the first part was a question to Zorana. Would you like maybe to answer to this question?
Sure, Mira. I think there was already some activity in the chat and answer. I think Maurizio Maggiore has posed this question about ultrafine particles and the particles below diameter 100 nanometers. Of course, evidence that I chose to present in the presentation was about PM 2.5, for which we have the most evidence. This is not to say this is the most important, and this is a good comment to point at the lack of evidence we have from ultrafine particles, and this is why WHO new air quality guideline does not make recommendation for ultrafine particles. Of course, this is not because they are not dangerous, they're not there. We just still lack the sufficient epidemiological evidence to set the recommendation. This is, of course, a very important issue. Lack of legislation is partially reason for lack of data, lack of standardized monitoring. Ultrafine particles provide lack of data for epidemiological studies, so it's a vicious circle. But nonetheless, this is where we are, and we see we welcome more studies on ultrafine particles. And I think some of the questions were already answered by Mikhail and yeah, in the chat. So I'll leave it for next question.
I want to comment just that Claudio, of course, said something I think I mentioned during my presentation, that energy industry is definitely one of the main contributor to air pollution, but unfortunately we have a lot of contributors, and mostly all of them are present, but I really hope the situation will improve. And of course, I want to say hello to Maria. Of course, her work is very important, and we hope that we'll continue our investigations about the impact of air pollution, especially these fine particles for cardiovascular disease in Serbia. Thank you.
Okay. There is also one question in the chat to all of you. What types of health information are most useful for public engagement on the topic of air pollution in the region? Is there someone that would like to answer this question from the speakers?
I don't know if Nebojsa, as a clinician, what type of health information is useful for? Well,
just,
yeah, go ahead.
I think, and then you go ahead, you first, of course.
Well, I think Summer made a very good point, and I think in generally people just know too little about air pollution health effects. I think we have a big job of informing general public and just raising some awareness and the interest for the topic. I think it's a little bit invisible because there's no transparency. First of all, in a region like this, just as Summer nicely said, we see that factories, but there is no data, there's no information how this impacts our health, how dangerous is it, isn't dangerous. No, but if it's not measured, it's not there, right? So I think, of course, there's a huge job in just relating what's around us to health and spreading information about it. I think that would engage the public. I think one of the very good ways for us, I'm presenting European Respiratory Society, exactly what we're working with Nebojša, to engage clinicians, to engage medical society, patient societies, people and patients that have felt it on their own health. I think a lot of patients are aware of these things and respond well, that there is something environment affects our health, and can engage in that anger and why there's not more done about it, because somebody else has to protect them against air pollution than themselves, what they can do. So that is one of my suggestions to generally, we need to inform more general public, but especially I think through clinicians and also educating clinicians how to help their patients be aware of the air pollution in their surroundings, how to avoid it, how to be aware of this, and to implement in their clinical work to protect patients is very important. Nebojša, to you.
Yeah, I just want to add, I think I completely agree with what you just said. I want to say something very important, and this is that the same thing as COVID-19. Air pollution doesn't hurt in a way you have no pain. You don't see immediate acute effects. It's a long-term effect of air pollution. And when you're dead, of course, then you don't care and you don't feel it, you don't. So at least you're not living in Zenica like Samir near the factory, or Smederevo near the steel factory, or some other cities like Loznica, or with some very heavy energy industry. You're breathing this air, you don't feel anything, and of course you're living your ordinary life. So what is the bottom line, what I want to say? And clinicians, patient association, of course, all other associations are very important, but we have to increase awareness of the general population by going for strong advocacy and campaign into the television, social networks, and all other kinds of media and all other way of marketing, because it's the only way to somehow ensure the general population about the very, very important meaning and longevity of life with the good air. But you know, on the other hand, I'm very pessimistic, because when I see the vaccination rate for COVID-19, then I see this is the same people. If you don't care about the vaccine, you will not care about the fresh air, you will not care about the water, and we have to work more on that level to really increase the awareness and education and health education of general population. And it's a very tough job, and we are like Don Quixote and trying to battle for something, for some battle which is maybe not lost, but it's a long, long years to achieve what we want to achieve. Thank you.
Thank you. Samir, would you like to say a few words before closing this part of the webinar?
Well, I have a lot of things to say, but I think that we have limited time. Maybe if someone, I try to answer the question from the Q&A in written, so we can use the time more effectively. But interesting thing would be to know the distribution of the different sizes of particles in the total numbers. I saw that in chat, there is a discussion between these PM2.5, PM10, PM1, and even these in nanometers. But we had here this methodology and software used by World Health Organization, AQI+. And our health officials, they used it to just to show the health effects of the air pollution, but it really cannot be used to perform any action except to alarm the public. So we need more reliable information, and especially to connect the information with the sources, so that we can attribute this, the pollution to the sources, and then we can define our actions. So this is, I have to point out this one more time. Thank you.
Thank you very much for the interesting presentations. With this, we will complete the first part of this webinar. Now I would like to hand over the chairing to Ms. Vlatka Matkovic.
Thank you very much, Mira. And let's just jump straight to our second part of the webinar, which is focused on evidence from the Southeast Europe. So really speaking about the data from the Western Balkans that we have. And it's called this session, Evidence from Southeast Europe on Health Effects of Air Pollution and Showcase of Health Research Conducted. First, let me introduce you to our next speaker today, Antigona Ukahejai. I hope I pronounced very well this. Dr. Antigona obtained her medical degree at the University of Pristina, where she also received a Master of Science degree in Public Health. Her expertise includes water quality monitoring, environmental pollution, and public health. She is currently Associate Professor at the University of Jakova, Kosovo, as well as Vice Dean in Medical Faculty in University of Jakova. She has also led projects on air quality with support from WHO and UNDP, and today she will be presenting about air pollution and health in Kosovo. So Professor Antigona, the floor is yours. If you could share your screen and walk us through your presentation today.
Yes, thank you. Good afternoon to everyone. Please let me to share my screen. First of all, do you see my screen?
We do. Can you make it like a larger?
Okay.
Full screen.
Full screen. It was good, but to try once more, please. Just a minute. Is good now?
Yes, good. Thank you.
Very good. First of all, thank you for the opportunity to present today to you in such a wide and important network of professionals dealing with environmental problems, especially with air pollution. Why my slides don't change? Sorry, just a minute, because my slides don't change. Okay, very good. Some demographic data characteristic of Kosovo, which believe differ from many EU country. Kosovo has approximately 2 million inhabitants. 28% of the population is under 15 years old. Half of the population is 28.2 years old. The average life expectancy in Kosovo is over 76 years. And unfortunately, we have 4.4% infant mortality. But which are the main problems with ambient air pollution in Kosovo? Unfortunately, we have the environmental problems, which is not considered an important priority in Kosovo. The exact rate of morbidity and mortality, also economic cost or absenteeism from work are not known. Kosovo does not differ largely from the other country in a Balkan based on pollution source. For that reason, we have pollution source from energy, industry, transportation, agriculture, waste, and domestic heating. And in the winter period, we have unfavorable meteorological conditions for distribution of the emitted pollutants into the ambient air and frequent smoke creation. At the end, the people's behavior, as previous speaker said, and awareness in the country in terms of air pollution are not sufficient. Which are the main study which was done in Kosovo related to this issue? In Kosovo, for 20 years, there have been analyses made by many studies made by international community on environmental pollution and the impact on the health of citizens, such as JICA, WHO, UNDP, MCC, SIDA, World Bank, etc. Recent World Bank report for Kosovo, which was done in 2019, estimate that about 760 people die prematurely even every year because of exposure to outdoor air pollution. Of the total attributable number of deaths to air pollution, 90% from them are from ischemic heart disease and stroke combined. And population age group between 15 and 69 years old are carry the largest share, about 45% of the total health burden associated with exposure to ambient air pollution, followed by people over 70 years of age. But Kosovo Air Quality Monitoring Network is now excellent monitoring network, because we as a beneficiary institutions were developed two very important projects. First of them was MCC project, Threshold Program for Kosovo, and it was a 3-year project. The key aim of this project is therefore to bring together knowledge, expertise, and data on environmental and health research and surveillance, and translate them into practical public health advice. Public education campaigns also was part of very important to explain for general population and for specific groups impact of air pollution and impact on human health. Now, air quality is monitored at the 12th station by Kosovo Hydrometeorological Institute according to the relevant EU directive. The monitoring component are for PM2.5, PM10, ozone, NO2, SO2, and CO. But we have another monitoring station, which is in the US Embassy in Pristina, which they also run a monitoring station, but they measure just PM2.5. In this table, you can see annual mean concentration in 12 monitoring station in Kosovo. But as my previous speaker said, and in Kosovo, unfortunately, PM2.5 and PM10 exceeded WHO limit values. Now, with you, I want to share with some of our study and research which we done in Kosovo over 10 years related with air pollution. Regarding health impact assessment in Kosovo, it was done by me during the years 2010-2012, and these data were published in my dissertation in Skopje in 2015. And through MCC project, we have done again health impact assessment in Kosovo this year for 2017-2019, but we are accepted to have final report and to publish the data. We have researched the number of morbidity cases of respiratory disease in children, respiratory disease of adults, and cardiovascular disease in Kosovo during my PhD study. According to cardiovascular disease cases, we find the positive correlation, which was especially high among patients over 69 years. It is known that pneumonia at the global level is deadly to children under 5 years. Therefore, in Kosovo, pneumonia had also a high incidence of children aged 0 to 4 and those 5 to 9 years old. We estimate also benefits of reduction of PM2,5 or PM10 exposure on cardiovascular mortality in Pristina. And we found that if we can reduce the PM concentration by 5 micrograms, will save 76 cardiovascular mortality case in Pristina. Also, we estimate benefit of reduction of PM2,5 or PM10 exposure in total mortality of Pristina residents. And we found that reduction of PM concentration only for 5 micrograms will save 53 lives in average. As you can see, we continue in further research and studies in Kosovo. And in this table, you can see another follow-up study, which describe hospitalization or rate of hospital admission in University Clinical Center during 2016-2017 on inter-season. And we found that when meteorological conditions are bad and when we have smoke episode, we have the number of hospital admissions increase too, especially for respiratory and cardiovascular disease. During 2018, we did another study on respiratory diseases where we found that the number of hospital visits and hospital admissions were higher during the winter period in the age group 1 to 5 years and 15 to 49 years, which are main NIPH intervention, which we need to focus on that. Unfortunately, the lack of data due to the non-integrated health information system makes it impossible to address the needs of citizens in addition to health problems. Therefore, NIPH needs a project related to the development of an integrated system between environmental, health information, and cause of death. To realize this project, we need tools and resources for establishment of a digital system in patient registration, establishment of communication network at the country level, and software installation and training of relevant staff. To strengthen the capacity of the National Institute of Public Health Organization and to do environmental burden of disease, really, we should identify organization divisions and individuals to be informed and trained on the aspect of the assessment of the burden of disease, to have more training workshops, study visits for the various officials performing the environmental burden of disease, and to build organizational methods and approach based on international standard and experience of Sisters Institute. Which are our priorities for improvement? Mitigation strategies that go beyond the control of combustions-related PMs must be implemented to reduce the health effect of PMs in urban area. There is still a great need for further research to be carried out in the field of environmental and health and effect, in particular related to health impact assessment of air pollution exposure, including the economic cost related to that. Environmental health information system must be established in Kosovo in order to enable a proper environmental health risk assessment study, which are our recommendation. Urgent need a national plan, an action plan for air quality improvement and management must be introduced with introducing evaluation criteria, including for public health effectiveness of the measures. An integrated environmental and health information system should be developed with an entrance in the referent international databases. Health, demographic, and mortality data should be available with a proper standardization and disaggregation. And also, special environmental and health research program for the country should be developed. If you have questions, I'm more than welcome to answer you. Thank you very much for your attention.
Wonderful. Thank you, Dr. Antigona, and thank you for sticking to the times. With that, I would like to jump to our next presenter, Mira Nadimovska. She will be presenting health impact assessment of air pollution, the case of North Macedonia. Dr. Mira Nadimovska is senior researcher, Institute at the Public Health of Republic of North Macedonia and assistant professor at the Faculty of Medicine in Skopje. She is a specialist in hygiene and environmental health. Dr. Dimovska conducts research in environmental health, focusing on the health impact assessment of particulate air pollution and especially in urban settings. So please, Dr. Mirjana, if you could share your screen.
Thank you, Vlatka. In a few seconds, I will share it. Is it okay?
Yes, very good. We can see it.
Thank you. At the beginning, I would like to say that I'm very pleased being here and to have a chance to present the case of my country, Republic of North Macedonia, in terms of scientific evidence that comes from Macedonia and that are related to my country. As Professor Anderson said, there is a huge body of evidence so far that proves there's a clear association between increased risk in terms of all-cause mortality as well as specific cause mortality attributed or related to exposures to PM 2.5 particles, especially in terms of ischemic heart disease, deaths, stroke, lung cancer, etc. But in order to interpret the data that you are receiving from such a type of studies, it's always necessary to have a basic information about the demographic structure, demographic characteristic of the population, about the social economic status of your population or analyzed population, about the total fertility rate, infant mortality rate, etc., life expectancy as well. And from this slide, it can be seen that we are a little bit lower, we have a little bit lower life expectancy in the country than EU 27 average, as well as that we are facing a serious and severe aging of population. Especially those data are presented from 2011 because we finished yesterday our last census and we are barely waiting to see the results because we haven't had any census for more than 2 decades. So I think that this pyramid that you see in this slide, it will be much more skewed than it is presented on the slide. Over here, I present the cause-specific mortality that we have in our country from all causes of death. Of course, as in other European Union countries, in Serbia presented the same almost percentage of cardiovascular or circulatory disease mortality. In my country as well, 54% from total mortality could be attributed is due to circulatory diseases. But it's worth to mention that lung cancer mortality is a little bit higher than respiratory mortality from other respiratory diseases. It's not possible for 15 minutes to present the whole air quality management, of course, but I would like to say that we have a beautiful cooperation with our Ministry of Environment, with Macedonian Environmental Information Center that are providing timely the data in appropriate format that we are need for such a calculation. And we have a good series of data. I presented here only 5 years average in order to say and to present to you that we have, yes, we have declining trend of PM 2.5 concentration, in this case PM 10, but we are not pleased at all with the pace of that decrement because micrograms or 2 per year is almost nothing, but still the trend is declining. From this slide and further on, I will present the current body of evidence that is related to Macedonia or that are coming from our independent researcher work. So I can say that the first study that is presented here comes from the my doctoral thesis. It was defended in 2019, but it's related to the period 2012 and 2016. But the real work started many years ago when Professor Georgiev, together with the World Bank, started doing economic analysis that analyze actually the cost related to due to premature mortality that we are losing due to current ambient air quality that we have in the country. Of course, as input data, some of the participants already asked which data do you need for such a calculation. It's normal to have the average because we are analyzing in this case long-term exposures. It's normal to have PM2.5 annual concentration, at least 3 years annual concentration data. Death rates, we can see that Macedonia unfortunately has very high death rate. And of course, in that time we had to work with Excel sheets, but nowadays the situation is quite better because air quality plus software provide us many options provide to calculate not only attributable mortality but the other issue that you need for better presentation of the whole picture. It was a city level study. I'm talking about this doctoral thesis. It was a city level study, but we calculate that we are losing about 22% out of total mortality due to current exposures in that time. You can see that we have very huge, I don't want to say enormous, concentration of PM2.5 particles. As well as in terms of the cardiorespiratory mortality, we estimated in that time that we are losing 28% of the total mortality. We do not have to forget that all of those lives that we are losing could be prevented if you achieve some level, at least EU directive limit value. The WHO methodology as well, one of the biggest advantages that allowed us as a researcher to calculate the health gain if you achieve, for example, EU limit value or WHO limit value, and it's presented on the right side of the slide. As I mentioned before, in 2015 was published a paper together with World Bank. They estimate in that time that we are losing up to 4.5% of our gross domestic product in the country due to premature mortality attributed to air pollution. Afterward, our cooperation with international organizations continues, working together with World Bank again and WHO. The second report of World Bank is tend to present some improvement in our air quality management. They presented that actually that costs are increasing in Macedonia due to premature mortality related to ambient air pollution, and they calculate the estimation actually that we are losing about 8.5% of our gross domestic GDP. The third study is very interesting. It was international cooperation with WHO, with experts from WHO. Professor Jovanovski is here, and I'm glad to present very briefly the data. It was a city level study, and that showed that analyzed actually the health impact in the biggest cities from Western Balkan countries, such as Skopje, Belgrade, Podgorica, Sarajevo, and many others. Our independent work as a researcher continued in the next years, and our efforts are published in many international journals. So you can provide, if you need detailed information, I provided to you the links. I want to present our current work. At the moment, we are working on the estimation for 2017 and 18. It will be published in our institutional annual report, but still they are not published yet. But still, we have to deal with 2017 and 18 because we severely face a lack of access to the data freshness, let's say, data for in terms of mortality. So we calculate actually the attributable deaths due to air pollution, and we compare to the different cutoff value, for example, 2.5 theoretical minimal level, based upon the measurement, the lowest level measured somewhere in Europe, then 20 micrograms, that was EU directive limit value, and 10 micrograms. I put asterisks because a couple of days ago the WHO lowered down the concentration to limit value to 5 micrograms. So we can see that we analyze total all-cause mortality here, 30 plus age group, and we estimate actually about 3,400 people that we are losing due to the current exposures. They are exceeding EU limit value, directive limit value. Of course, the number of people who are dying because of the exceedance of EU directive limit value is significant as well. And as well, we calculate the lung cancer mortality, and we can see that we are losing a lot of lives that could be prevented with not so expensive actions and policy or measures. At the bottom of this slide, I provide to you some comparisons with other studies, especially WHO city level studies or EEA study on annual report actually. So I would like to say that our findings are almost the same like EEA limit estimations conducted and published in 2020. But they are related for 2018. Of course, as expected, the burden of estimated attributable deaths is highest among the older population, especially 65 and more, in terms of ischemic heart disease and stroke as well. What to say in the country with the highest, unfortunately, it's not good to say, but we have the highest mortality rate from COVID. And that's why, as a researcher, it was a challenge to catch that moment and to analyze how the COVID lockdown that has been implemented at the beginning of the pandemics influenced the mortality and influenced the air quality in the country. Unfortunately, we couldn't get the information on mortality from our state statistical office. We are still waiting for those data for 2020 and 21. So we have to work with what we have. So we analyze only the effect on air pollution, air quality. You can see the number of confirmed cases in the country from the region, and of course the COVID deaths expressed as a rate. It was a real challenge to analyze the improvement of air quality. And in many studies, they reported the biggest percentage change during the COVID lockdowns in terms of NO2. We find that the same findings, but I presented only the trends of PM2.5 particles during so-called COVID-19 period, which means February to May 2020. I must admit that we have the same trend during the same period, previous period of 3 years, so-called no COVID period, but with statistical methodologies and operations functions, we succeed to prove there is a statistically significant difference between non-COVID and COVID period. You can find detail on the provided link. Over here, I present the percentage change, and we were very surprised when we got the results that in the city of Skopje, which is capital of Republic of Macedonia, we reported actually the highest percentage change in terms of the decrement of the concentration of PM2.5, NO2, and PM10. What are the conclusions? That we are losing a lot of lives, and related economic costs are significant. Still, we are not allowed to lose so many lives and so many money due to air pollution that could be prevented with not so expensive actions and measures. And we are pushing our authorities and the other stakeholders in air quality management to facilitate the pace in terms of the decrement of the PM2.5 concentration, because that is the bigger environmental and a public health issue in the country. Our recommendations are related to the main pillars, such as such a study to be a base for targeted development of targeted policy intervention, especially to improve the access to the vital statistic data in our country, to put a lot of attention to strengthen the capacity of our institution, to improve scientific work and scientific networking that, in my opinion, is lacking at regional and international level. And of course, deepening the cooperation between all the parties involved in the air quality management is crucial for for the whole system, not only the health system, but as well the whole system in general. Thank you very much. At the end, I present the city of Skopje during the winter period. You can see we do not have any skylines. This is the only one, 40-50 stories building, and the city of Skopje is below the clouds. Thank you.
Thank you very much, Dr. Mariana, for such a packed presentation with so many data, and as well from Dr. Antigona. And as you can see, like in Western Balkans, once you approach it, you see that it's a very critical situation in terms of levels of air pollution and premature deaths, and obviously economic impact on is huge and immense. And I would like to open the floor to the questions. I see that there was one question about the monitoring network and how can this successfully be moved forward in Balkans. Does anybody of our presenters today have a comment on this?
If I can comment on the monitoring network.
Sure, you just can come in.
Okay, about the monitoring network, the measuring instruments are expensive. What's more expensive is their maintenance and calibration. We are suffering in Bosnia and Herzegovina. We have so many problems in calibration of the instruments. For example, in our city, we have a specific air pollution from the steelworks, including some organic pollutants, such as benzene. And our city purchased and installed the BTX module in their air monitoring station. And this module is so expensive to maintain and to calibrate that it's not working for years. So we still don't have the relevant information. Maybe the regional cooperation would be the answer to more effectively use the available instruments and to maintain them and calibrate them. I know that all the hydrometeorological institutes or other institutions which are in charge of maintaining this network, they struggle to have the reference laboratories, the calibration. These are the problems that should be tackled in the future. So this is the most important thing, to maintain these instruments and to calibrate them.
Thank you. Mariana, please go ahead.
Yes, very briefly, I agree with the previous, with Dr. Samir. I would like to say that in Macedonia, we are meeting the requirements of EU directives in terms of the number of monitoring stations, but the maintenance of the monitoring stations is a real problem. And of course, the scope of the air pollutants that could be measured at the monitoring stations is as well as a problem, because not all of them are measuring PM2.5 particles. But I wanted to say that also the source apportionment study are missing, and in our country, for example, are making only the studies for the capital cities. So that could be a good contribution to have the whole holistic picture of the problem, because you have to know what is the composition of PM2.5 particles in order to prevent something. Thank you.
Thank you. I saw in the chat before that there was a bit of discussion on health impact assessment and the role of Public Health Institute. And because our speakers are from Public Health Institute, like, could you comment on this and see how we can link this monitoring of air quality, right, and health data and health monitoring together?
Okay, I was waiting for the other participant, but it's okay. I think that our role is crucial because we are the link between the environmental sector and the public, who are very, very much concerned, especially when we have such a high concentration. So it's not only our role. What is our role? To improve or to increase the public awareness, of course, but providing the data that are scientific data, to provide the evidence based upon the studies conducted from our independent work or our international cooperation. So it's, in my opinion, in my country, people are trusting us as a researcher, but still we cannot convince our politician or decision-making people that we are losing a lot of years of life lost. We are losing a lot of lives here, but they have to do something in real to have a consistent measures, because we have a very well written policy and actions or actions plans, but implementation of those policies is lacking. So I think that our main role is not only public awareness increment, but as well as to provide such a study. Scientific work in our country is not recognized at all as a very important in general, not only in public health, because only less than 2 or 3% of the total GDP is dedicated to the scientific work to all institutions in the country. So, for example, for such a study, we work with our own finances or with very limited institutional finances that we have at the moment.
Thank you very much. Mira, you wanted the floor?
Yes, yes, I just wanted actually to read the question from question and answer from Peter. He says the levels of air pollution are higher in the Balkans than many other parts of Europe. Why is that? Can someone give a short response to this question? I think it is very interesting to understand this.
May I?
It's me again. I don't want to dominate, of course. I apologize, maybe Dr. Antigona wanted to say something, but I think there is many reasons for such a situation, not only geographic position of our country, all of them, but as well meteorological conditions that we have in the countries. But we do not, I must say that we are highly dependent of energy productions that comes from our thermal power plant that are still running on coal. That is, according to me, a very important contributor to the air quality that we have in the moment. And we do not meet the requirements of European Energetic Group that they are asking us to speed up the pace of and to get rid of the use of coal in our thermal power plants. We have ideal conditions to use wind as an alternative energy, to use sun and other alternative and green energies, but unfortunately we are not doing. At the end, I would like to say, that we do not have to forget that people's behavior. We are not so rich to behave like that, because people don't want to give up to use their own cars. You can see on the street, one person in one car. They don't prefer to use public health, for example, public transportation. So all of those determinants are contributing to the situation that we have. I'm talking about my country.
Thank you very much. Really important points, energy use in thermal power plants as well as domestic heating of different kinds of fuels. Antigona, maybe last word for you, and then we will be closing this session and webinar in general.
Thank you. I just want to mention that problems in Balkans related to air pollution are the same, because really we do not differ for many reasons with main factors or pollution factors. For that reason, we should enforce our rule in this field instead of if we wanted to relate it with health impact.
Absolutely agreed. And with that, actually, that's really even excellent closing remark, that we should enforce the rules that already exist in Balkans. They're not that bad, or it's just the implementation of it. And Dr. Dasic said it really well and wrote it in big letters: prevention. And prevention in these terms is like less emissions and less air pollution. Mira, maybe your closing remark, and then we give the floor to Health Effects Institute.
Okay, shortly, I would just like to remind us that we all know that without air, life is terminated in a couple of minutes. However, not so often we think of the impact of the ambient air pollution and the diseases related to it that lead to premature death. I think that experts in the field have the obligation to inform general population more and more, because we are really in a bad situation when we are talking about air pollution in southeastern Europe. I will use also this message that came from Dr. Lemesh, in which he said that he's thanking Mirjana Dimovska for this interesting research, and that it would be interesting to perform a similar comparison in the Western Balkans, or maybe Western Balkans and beyond, to include the Southeastern Europe Health Network member states. And I think this is something that the network will probably have the possibility to perform. And since we are talking about a region which is very polluted. So with this, I would like to conclude and to thank all the participants, the speakers, experts, and of course, the health, the HEEI for the wonderful webinar. Thank you.
Thank you very much. On behalf of HEI, I want to sincerely thank the co-chairs and speakers for sharing your very important work on air pollution and health here with us today. I'd also like to thank the HEI staff for their instrumental help in developing this workshop, specifically Pallavi Pant, Senior Scientist and Global Health Program Lead, and Joanna Kiel, Research Associate, as well as Michal Krzyzanowski, who serves on HEI's Global Health Oversight Committee. And of course, all of you who joined us today here, you can see here we have two more exciting webinars coming up in December and February. First on the air quality and health data streams, and then second going from global to local, and really how can we inform the air quality policies and decision making, integrating what we've learned in the first two webinars. So thank you all again for joining us. We hope to see you in December for our next webinar. Thank you.